Okay, welcome everybody. Uh, in Tonight, so we are live again, and we are again on another Saturday session. It, so fast we are already end of February. It's only 28 days in February. Anyways, one of the shortest month. And yeah, we are keeping things moving forward. A lot of people will be starting school and classes offline starting March, so that's great. So we're getting our vaccine, we are getting our new norm, right? We're living the new norm. So tonight, again, we have Prof. Mohammad, myself, and Coach Wong. So we are basically from PRKPP, under the PRKPP roof, and together collaboration with Fit Unit to talk about to keep things um, in terms of mental health. So this is Ask the Experts session. And so we talk about mental health, we talk about physical well-being, all right. And the best thing is that we keep each other company, and there's a lot of Q&A. So there will be tonight we have about 12 people on the call, and we also have our Facebook live session going on as well at the same time. All right, so tonight's topic, okay, tonight's topic is very interesting. Tonight's topic is about psychological first aid, managing a crisis. So, what do you do when you have a crisis? How do you perform a first aid? So, if you can't breathe or you are out, you know how to perform first aid, you know how to call 911. But when you are having a crisis, in terms of sometimes it may not be physical, but could affect physical, but it's more psychological, right? So how do you manage that? So we have Prof to enlighten us tonight for this topic. So the floor is yours, Prof.
Okay, thank you, Felicia. Very good evening to everyone. Assalamu alaikum warahmatullahi wabarakatuh. Once again, we meet tonight on a Saturday night. Hopefully, it will bring some benefit to us with this sharing, especially this knowledge is very important. As we know that this topic is also a very important topic for all of us who actually will be, whether we like it or not, will somehow involve us. So first and foremost, let me just share my screen. Okay. All right. So this is my first slide. So tonight we are talking about psychological first aid. Most of us are very familiar with the term medical first aid, or we call it physical first aid. That is usually when somebody is involved with some kind of injuries or some kind of mishaps and involve kind of a body. So we can offer medical or physical first aid. But today we are looking into psychological first aid. But before that, let me also emphasize, previously I also emphasized on so-called mental health facilitator program. So as you know, the word facilitate means to make things easy for your so-called client or people around you who needs help. So that what this facilitator is all about. But to do a first aid means you are going to attend and to do some kind of intervention. So there is a difference between these two terms. So usually we can be a facilitator to start with, and on top of that, we also can offer first aid. Right? So here I would like to emphasize what it means to start with. Right? I hope you can see the slide. All right, the meaning of psychological first aid, as you know, it is a first order response. That means we are the first responder, right? It is usually of a very short duration, but it can actually as short as on the day itself, and we actually noted someone is having psychological trouble. It can also actually last for about a month before the acute stress end up into a post-traumatic stress disorder. So if it goes beyond a month, then obviously it's no more first aid in that sense. Actually, we have to do some kind of already a mental health first aid, because a mental health first aid means that they already have a psychological problem. Probably we can make a diagnosis, and by that time, actually, we may not have the ability to do, but the so-called professional or the para-professional maybe can assist. So in terms of facilitator and in terms of psychological first aid, it can be for the lay person, and then subsequently the lay person can be trained in a way become the para professional, the one that has a little more training, and subsequently then we can pass it to the counselor, trained counselor. We can pass it to the psychologist, and subsequently we can refer them to the psychiatrist. Yeah, so usually the lay person is the one who's handling mental health facilitation and psychological first aid. So usually the duration is short. It is to a person who are experiencing some kind of distress, and usually the distress come about because of a disaster or calamities or any kind of emergency or any crisis that need the person to actually the person who face it need to cope with the situation that they are in. So as a first aider, psychological first aider, we are the one who is going to assist the client that we are seeing. Subsequently, who require PFA in short, these are the person who are in crisis. In crisis now, with regard to pandemic, obviously there are still people who is experiencing crisis. That means before they only were actually not directly involved, but now to some maybe they are directly involved, so they are in a crisis. So later I will tell you what the crises are. And after a disaster, so we are dealing not only to the person, the survivor, but we are also dealing with the people around the survivor, the relative, and the people who actually come to assist the survivors, the families and the first degree family, the kampong folks who trying to help out and things of that nature. So what are the types of crises? Basically, right now we are in the public health crisis, the COVID-19 pandemic, but there are many other crises. In fact, subsequent from public health crisis, some people actually end up having financial crisis now, right? Some people possibly have other personal crises that they are experiencing, all right, in terms of relationship and whatnot. Yeah, example like abuse and violence. Crisis of malevolence means some evil, somebody is doing evil to the person. So that is what crisis of malevolence is. Then crisis of deception means somebody cheated you, or you have been cheated by someone. You have now lost some money or lost something of that nature. All right. Then they have other crises that we can have. Confrontation crisis could be, this is where you and someone is at a situation whereby, it is more of aggressive tendency. It is more of the, relationship issues that we are facing. So right now we are actually in a public health crisis. Uh, some countries, beside the public health crisis, they also have natural crisis. In America, it's very common to have typhoons, hurricanes. In some other countries, they have earthquake and whatnot. So these are all the crisis that is happening around the world right now. And we know that one of the reasons why this thing comes up is because of climate change. It's because of we have somehow, in a way, destroy our environment. So that is the key to what is happening right now. The virus are coming up. The virus are more virulent. The virus are more contagious, and then a lot of those so-called disasters and things of that nature comes about. And here's another way to look at it. There are natural and human causes of disaster, earthquake, extreme weathers, and that industrial technology major accidents. These are like, where the so-called in a factory and thing of that nature. Possibly there is some disruption in the technological aspect of it. And then we have this traffic, kind of plane, train, or boat, or cruise ship, or things of that nature. Then we have bioterrorism, In fact, COVID-19 was initially said to be possible one of the bioterrorism kind of cause. So people have been looking into that, but they have found out that it is nothing to do with that nature. There's also armed conflict, international or internal. In some countries, as you know, there's non-stop having this kind of a war. And there's about migration and things of that nature. We know some people are trying to run away from their place because of the situation that they are in. So there are many things that could actually end up as a crisis. And usually crisis is for the nation, for the national level, or for the country level. But actually, when we look at it at the micro level, it is can also become a crisis in a particular state, a crisis in a particular region, a crisis in a particular community, a crisis within the family. So this is how it actually spin down to other people that is involved in the crisis. Yeah. So right now for COVID, you also getting into what we call mental health crisis and economic crisis. These are the two important issues about COVID-19 pandemic. We have got the wave one, which is still, when it started, it wasn't really that bad. We were not really being hit that much. But subsequently, when it goes into wave two, and it goes into wave three, things are even getting worse now with the numbers. And now knowing that there is mutation in the virus, there is variant that actually get to combine two different variant, and that is much more sinister now. So obviously the crisis is getting more and getting worse, and the area that we are looking now is the mental health crisis. So that's why this topic has been brought up. Okay, as you want to look at this, basically focus on psychological first aid. Let us take an example of this COVID-19 pandemic. How does it affect the mental health? As you know, when you can see what is going on here, uh, there are there are many reasons why it does affect the mental health. So directly, COVID infect the person, but there are the aspect that is also involved. We don't have enough knowledge about COVID, about the infection, about the virus, yeah, and we are not sure how to handle them. So that could be one of the issue here. And then obviously we also were not able to go for mental health assessment. We were isolated. We were actually confined. So it could be an issue because of not having a proper early assessment, so that we can do early intervention. Then there is another aspect of economic problem, aspect of nutrition, aspect of sleep, right? And so there is also inability to adapt. This is another issue, right? Obviously, we have issues of coping. We have issues of social impact on social media towards us. All the news, all these, that what we heard globally and locally. So those are the issues again that actually affect the mental health. And then we get confined, we get quarantined, and on top of that, they are put up in laws and things like that, which is already forced quarantine. That doesn't make people happy because we completely has been in a way have to be physical distancing and also have to be socially isolating among us. That is not the nature that we are actually. Human beings are a very social animal. We want to go out, we want to meet people, we have relationship, we want to go to work. So now we are stuck at home. So these are all affecting our mental health, and that caused fear, and subsequently the fear became anxiety and affecting our so-called physical and psychological health. And then obviously it will end up with either a mental health problem. Anxiety and depression is very common here, and also acute stress disorder to start with. And if it goes prolonged, it becomes post-traumatic stress disorder for those who are directly involved with the infection. So this is what happened. Let me just highlight to you first what is going on. And subsequently, there is also, for those who get infected, there will be physical effect. And as you know, even actually less than 1% or even like 0.4% only that death comes about. But actually the physical effect is long lasting. For those who have respiratory problem, even though they are out free of the virus, but the residual effect for the respiratory system and other system can be prolonged, and people can still die just because of the residual effect that they have. And subsequently, obviously, the mental trauma to a lot of people, especially for a family, for the in a family, if there is one of the members get affected, the rest of all actually suffers mental trauma. So everyone has to face with this kind of a problem. So the other thing is about the fear of unknown or not knowing how this thing will come out, how when will it last, how long are we going to stay within the situation, and that will subsequently affect the economic standing, affect the mental well-being, and affect the physical well-being too. Right. So these are happening, and this is already considered as a crisis. So now also there's another issue of physical distancing, can't meet up with the family who stays away from us, can't visit, can't have this festive season, can't actually celebrate festivities. There's been like a year, for the Chinese New Year is already like round two, where people cannot actually do celebrate Chinese New Year. And subsequently, I think like our Hari Raya also will be possibly having some kind of a difference this year. Similarly, also, people cannot meet eye to eye, person to person, even though we can still communicate using this so-called virtual in nature or using this technology, but we are not really satisfied with what is going on. So these are all creating a kind of a stress or a kind of crisis to a particular person. So relationships obviously is the other issue here. So we tend to now cherish the relationship because we are forced to be, away. So the forced absence actually make us now realize how important relationship is all about. So anyway, it is advisable to still keep in touch through the video call and whatever the tools that we can use so that we can meet virtually. So at the end of the day, obviously it affects the mental health, the brain area, whereby the psychological or the mental health, we end up with anxiety or depression or stress-related disorders. So here, CDC has done their survey. So with regard to mental health, with regard to substance abuse, suicidal ideation during this COVID-19, there are quite about one third like having anxiety and depression, 30%, nearly about one third also having trauma or stress-related disorders. And under stress-related disorders, you can have acute stress disorder, whereby it lasted for about a month. And if that acute stress disorder has not been sorted out, it becomes post-traumatic stress disorder. The others can have phobias, the others can have anxiety, generalized anxiety or specific phobias can happen. And OCDs can come out also very well, as we have discussed last week about people having trouble with substance abuse. So it's about 13% and about 10% actually possibly because of economic issues, because of loss of job. So suicidal ideation and suicidal behavior comes up in the picture right now more. So there is also this spike in self-harm, suicidal ideation within this COVID pandemic. Yeah. So what to do? This is what we are here. So we have this 7 item or 7 key component how you can provide psychological first aid to others. All right. It is for a lay person. It is not at all. You can say that you can actually be a first aider, but somehow you must know what it is all about. So it is not counseling. It is not offering specific help like the counselors or the psychologists or the psychiatrists doing it. It is any lay person actually, if they understand the term, is first to start with being show your humane side. That means you care, you concern, you sympathize, you empathize, you show your compassion to the person who is involving having that trouble. That is the first part of actually psychological first aid. You are there for them. Then you become supportive, and that you actually you are not trying to get anything much from the patient. You just or from the client. You just be there to respond to a fellow human being who are suffering or distress within that crisis situation. Just be there for them. All right. So first aspect is care for the immediate need. Have a look at what they really need. Maybe, example, if there is a crisis of this nature, there is a loss in the family, or there is a mishap like flood or fire, so they don't have a place to stay. They don't have any other things to, to get their living going on. The basic needs are not there, so you can assist by trying to, help out with the immediate needs. So that is number one. Be a care person as the first part of the psychological first aid. Then secondly, you try to prevent from further risk of having any other issues following the threat or any other following threats from the key or the main threat. So you do what we call, you protect the situation, you protect the person, you protect himself within the environment. So that is another issue here that you need to know. At least after you care, you must try to minimize or mitigate whatever the problem is. Try to offer as much as possible, mitigate the risks that the person are within. And then thirdly, you must offer comfort. You must be a person who able to console, uh, in a way, giving your listening ears, giving your shoulder to cry on, kind of a thing. That could be part of so-called comfort. And if you were to look at these three items, or maybe you can also use the fourth item, support. If the fourth item, you can try to do something practical in nature to support that person, to help out what is in need. Let's say they don't have items for them to start to even continue living for the day, for shelter, for food. So you can try to work on the support. So actually the first three could be already what we call the facilitation part of it. But facilitation is just basically, as I said, to make things more easy for the victim, so that they can move on for the day, not feeling so distressed. So facilitation is a very first part that you just assist whatever you can, and subsequently you can do all this, which is under first aid program. Right? And you support, you give the practical things to do, how to handle the problem. Example, as I said, for the shelter, maybe you help out to bring them to a proper place for shelter and things of that nature. Or subsequently, you trying to look for resources of support, and there you can mobilize them. To facilitate, you actually just help them to reach out to the resources that is available to support. Then you can provide information on how to deal with the problem. That is also a first aid. You give a little situation advice, kind of a thing. All right, you give information on what is going on, and how to then give them some idea and knowledge what they are experiencing. All right, you try to connect them with social support. That is another way of looking at it. All right, so with education, uh, and then with connection, I think the victim will feel much at ease. So if we were to look at COVID-19 issues, these are commonly happening if the family, there is one member in the family who's contracted the disease, or there is death in the family. These are the crises that they are facing. So because as you know, with social isolation, if there is death in the family, they can't attend to the disease, they can't do anything much. It is quite if one of the family got infected, got admitted to the ward, they won't be able to see, they won't be able to give support. So they are actually facing crisis. And on top of that, as I said, keep continue trying to educate about the supposedly responses, which is proper responses. So educate them. So as you know, this crisis will never stop with this pandemic, because some people are still experiencing the issue of getting infected, the issue of losing job, the issue of breaking up in relationship, the issue of people within their homes are all getting stressed up, and on top of that, so there is a lot of animosity, there's a lot of quarrel, and there's a lot of so-called dissatisfaction going on. So these are the crises that people are facing. And if you are there, even as a family member, sometimes obviously, as I said just now, the survivor plus the relative plus the first degree family are affected. So we were hoping that the outsider who can help. But if any of the family members themselves are very strong enough and they are quite, how should I say, not as much affected, maybe that family member can offer the psychological help for those around them within the family. So these are the things actually that we need to look at, how much that we can care, or how much can we offer the immediate needs. If we can't, and then if we cannot, we can look for support. How much can we offer actually comfort or protection? Example, there's a crisis if a family were involved in a road accident, you know? So how can you then minimize the risk? Possibly maybe one disease, but the others are still okay. So you are there to assist, and that is where you can offer your first aid in terms of protecting the situation, protecting the added risk that could happen. And then how much and you can offer comfort to the people, and then subsequently you can work on the other things too. So basically, the idea is taking good care of yourself or the victim. Yeah? And here there's another way to look at how psychological first aid can be offered. After looking at their basic need or looking for their basic need, what do they need at this time around, what kind of a comfort that they need, what kind of necessities that they possibly lost and things of that nature, then maybe you can be a good listener, just listen to their needs and listen to what they have to say. So you don't actually question them a lot. You just be there and not to pressure them much, not to ask them to tell you anything, but just trying to be there to assist and then to offer what you can offer. So you can offer comfort, you can try to get things connected, you can try to instill hope, and you can try to protect them at that point of a time. So remember, it is something that is so acute, it is something that you must do within the time that you actually met up with the victim, and that is where you can offer them this psychological first aid. But subsequently, maybe you still have time. As I said, usually the first week they still need your aid, so you continue offering the aid, even though if there is any other support comes in, then the other support can continue helping out, giving the so-called first aid. As I said, it can last for about a month. So if you were to be there, look, check for the safety, check for the example, like, if there's a house on fire, if there is, somehow earthquake and the house is actually really ruined. So you can look for the safety, bring them out of the unsafe area, right? And also look at how the person actually show their distress, right? Observe and trying to understand, because some person may become so hysterical, some person may completely have what we call the grief reaction, become shocked, become numb, doesn't know what to do, just remain there, not able to respond to anything. So you have to assist that person to bring them out of that unsafe area, to give them comfort and things of that nature. And subsequently, if they can say something, you just listen, you approach to them, you try to understand what their needs are, what are their concerns, what are the issues, and if possible, offer some calm kind of ways or calm talk to them. Just let them feel calm and don't try to get into discussion. Don't try to look for why. Don't try to ask for more. Just be there for them, right? Then after listen, then you go for link. The link means you try to see whether you need to fill up what is lost there in terms of basic needs, basic safety, and basic security. And then you can look for services, whether you can offer support, social support, and then get them connected to services. So that is under link. And so the other thing is limit yourself, all right, whether how much can you offer, if need so later, possibly like even like medical first aid. You just assist at that point of a time, but subsequently you have to call for the ambulance. You have to call for the health, example, the hospital staff or the first aid team to come. So you are just there to actually give whatever that you can give because you are not properly trained. So you must recognize that when it becomes to the situation of a professional care, so you are actually trying to get them connected to the personal care, professional care. Okay, so this is the last slide. We can use this acronym ASSIST in terms of psychological first aid. Number one is approach the individual, introduce yourself, all right, trying to get them to know who you are, why are you there, all right, state from which organization you are, and be polite and try to be professional. Remember to be very courteous. Remember to actually address them as a person, not just something as a thing, right? And then try to bring them to a safe place, a private place, so that they are away from the danger, all right? And then maybe over there they can actually start to talk to you, kind of thing. Then the second S, the first S is to stabilize their emotion. So if you are calm, they will be calm too, right? They may be shocked, so they are not listening to you well. So maybe you need to sometimes calmly keep repeating, telling them what they can do, how you can assist them, and things of that nature. The offer to guide them through example, if they are panicking, if they are stressed, then you can offer like breathing exercise, ask them to follow your breathing exercise, ask them to just focus on you, not to focus on the surrounding that distress them. So these are the first S to stabilize their emotion. If you have to actually do some kind of a touching and things of that sort, maybe ask for permission to start with, yeah. So don't just with our culture, maybe it's not as simple to just touch our victim or clients. We don't call that client. We don't call them client. Basically, we call them victim that we are trying to support them as much as we can. Then serve their needs. The second S, ask them what they need. Don't assume what their priority are. We need to ask them what they need. If they don't know, then offer some kind of practical support. Example, first and foremost, maybe water. If they are in the sense of fire or in the sense of flooding, maybe you can offer this kind of example, a blanket and things of that nature. Help them to find any missing family. If they were running around looking for their family, then you can assist them to look for these family members. And the acronym I is to inform about the facts. So give them concrete information about the incident and any relief efforts that is underway. So that is another issue. Inform them of the things that is happening, right? But don't make false promises. That is very important. Never ever to generalize things. Never ever say that everything will be okay, kind of a thing. Never give false assurance. That is important. Be honest. If you don't know the answer to the question, be honest yourself. And if possible, support their privacy, respect their privacy. Don't pressure them to tell you what is going on and ask for personal detail. Right? At that point of the time, they don't even want to listen to all this questioning. All right. So obviously, just listen to them well, right, and let them either speak up or cry out and things of that nature. So just be a lending ear or shoulder to cry on. And the last T, turn them towards the other services. So you can redirect them to the relief station, maybe you can direct them to the resources that is available within the situation that they are in. Maybe at the end of the day, you can assist them to reach out for better help, professional help. All right. So these are my slides for this topic. So if you were to know, it is quite a simple phenomena with regard to a first aid, what we can do, and subsequently only then we move on to the para-professional or the professional worker to assist us. Okay, so with that, this is, I will unshare my slide and actually we will continue with our discussion.
All right. Thank you, Prof.
So,
So just to get to know the participants, maybe you can type in the chat room just to let us know that you are in, and perhaps just introduce yourself, your name, and also from where are you from at the moment, your location. So yeah, so it's quite interesting to know where is everybody tuning in from.
yeah,
Okay, so if
just
anybody is still listening,
put on the
great.
camera.
Put on your camera as well, yeah, because you want to see everybody. Yeah. All right. So, anyways, I really enjoyed the session. Hi, Nurin. Great. I think Nurin is in Ipoh, right? Oh, I have to allow people to unmute as well. Let's see. Okay, you can unmute if you want to speak up.
Yes, as Unipo.
Yeah, it's in Ipoh. Okay. How about Aisha? Aisha just joined in, I think, not too long ago. Where are you from? So there's Amani, as Ayub Jasram, K, Norhani. Okay. So awesome. Great. So yeah, the sharing is really good. Maybe one of my first question to, um, I think it's really good to understand how do we do psychological first aid.
Mhm.
Do you recommend, like, sometimes it's not easy for people to open up. So one of the things one of the sessions that I've conducted with my trainer friend, we spoke about it's okay not to be okay.
Yeah,
Yeah, I think first aid sometimes is easy for us to sort of like lend our support to somebody, right? So in my question, maybe I'd like to just start before we have any other questions.
mhm.
Um, can we apply this first aid on ourselves?
Well, to start with, I would say if you know what to do, possibly you are actually able to control the crisis situation.
Mm,
But most of us, especially in a very shock state, example like a crisis that could happen, yeah. If you were driving along the highway, somehow you get involved in an accident, and by then you already lost your ability to think. So we call it you are in a shock state.
okay.
So even though you're a very capable person, maybe for me I'm a doctor, for me I'm a psychiatrist, if I'm in shock state, no, I can't do anything for myself.
Mm,
So unless you are really well prepared for all these calamities, example like some people has never experienced flood, some people has never experienced earthquake, some people has never experienced hurricane or typhoon, and then suddenly those kind of a thing comes about. Because of fear, actually it is so paralyzing. Most of us will actually somehow, if you have never ever been tested that way, I think you don't know how to respond to it.
right.
So it won't be easy for you to handle the situation unless you have a very strong mindset about how you see all those things prior to this. That means you're quite prepared.
Mm,
If you're not prepared, that's why I said things that come in a surprise could be very bad for you in that sense. So always, if you want to survive, if you want to be a resilient person, you must always have this phrase with you. Always expect the unexpected.
mm,
So if you don't expect the unexpected, it will come to as a surprise to you.
yep.
The other thing is with regard, if you are trying to assist the victim, don't try to get them to say anything.
Okay.
Just be there. If they want to say, then it's well and good.
I remember
But
you mentioned the one of the things that we can do is to ask if they want to talk about it,
yeah,
and if they want to, they will, and if they don't, you just say, I'm just gonna be here for you as a friend. If you need anything,
mm.
please do let me know. Yeah.
Example, they may very be so panicky.
Mm,
Once they are panicking, they may say a lot of things.
yeah.
when they are panicking, they may have in fact give an impression that everything is going to be doomed, everything is going to go bad. Yeah. So you can't even say to them, don't worry, nothing will happen. As
Yeah.
I said, don't say those kind of things because they won't
Mm.
even recognize what you're trying to say.
Yeah.
They're already in their shock state, they can't even receive any information. So
Mm.
if you would try to do that, it could be very difficult. But I understand that sometimes you need to do something to make them realize. Example, there is a story about how hypnotherapy comes about.
Okay.
There is a doctor friend of ours, a very senior doctor friend of ours, who actually was doing his course in UK,
Mm.
doing psychiatry. So then subsequently he was there to witness a motor vehicle accident. So unfortunately, one of the person died, and the other person was so panicking, injured and whatnot. So at that point of a time, he applies what we call focus attention.
Mm.
He just want that person to just look straight into his eyes. He just keeps saying, "Okay, look into me, and just listen to what I'm going to say to you, to give you
Okay.
instruction." That means to overcome the fear, to overcome the so-called what is going on in the mind. Ask that person just to follow it. No need to ask to say to listen to what is going to say. Just follow what he's doing,
All right.
and that actually calm
Help.
the person,
Mm.
help the person, and with that kind of a calm, in fact, it actually prevent from bad bleeding. The
Mm.
injuries bleeds a lot, and when you become panicking, you bleeds more.
Okay.
So because of that his kind of a situation that he bring this person, he's more relaxed, and when he's more relaxed, somehow the bleeding was able to control, and fortunately that person survived.
Wow.
So that is how we can apply sometime for somebody to just give a focused attention on you and just follow what you are doing to prevent them from. You see, if you know that someone is so panicking, they don't even know what they want to do. So
Mm.
now you help them to do what you think they should do.
All
So that
right.
could actually that could, but not to tell them to ask them to listen to you. I think that won't be
Yeah.
you won't get anything out of it.
Because you probably force them to shut down even more.
Mm.
Hence why certain things, these are really good knowledge because we are not in their shoes, but we must
Yeah,
understand.
we can't
Yeah,
appreciate them as much. We can't
right.
appreciate what they're going through.
Mm, mm. All right. Okay, I think that's a really good sharing on the how from like a trauma or a physical injury that you can help a
Mm.
person to calm down and to receive like further help and yeah, manage to save his life. So I think that's really amazing how the mind works. You were saying it's focus attention, right, Prof?
Yeah. That is actually part and parcel of trance states. You
Okay.
can bring him to a trance state. He's more calm.
Mm.
Right? And focus attention can also be very mindful. Mindfulness also can have focus attention.
Okay.
Both works the same way.
All right. So I think that's one of the things that we learn, and it will affect definitely physically and mentally, but how do we
Mm.
conduct first aid,
Yeah.
in a more holistic way? Because you can
Mm.
see if somebody is obviously bleeding, but you cannot see if that person is affected in terms of going
Mm.
deeper and deeper and they don't want to come out. So
Mm.
that is definitely very much so, like like you said, nobody has really prepared for expect the unexpected, right? I don't
Yeah.
think people will expect to be like stuck at home during the pandemic. So
Mm.
it's for a lot of experience for different, it varies different experience for different people. Some of them are probably not used to being alone, or
Mm.
some of them are, probably has that. In a way, it's called like a, when we are in confined spaces, it's like very claustrophobic kind
Yeah.
of feeling, of not being able to see what's next. And yeah, and so if we notice this kind of red flags and we notice this kind of symptoms, I think it's
Yeah.
really important for us to look out for our friends and loved ones.
In fact, the irony of the word penjarakan,
Mm.
The spelling is penjarakan.
Penjara.
Yeah. So
Right.
that is where they say confinement means, oh, you really being jailed in your house.
Right.
Luckily, it's
Right.
your house. You know the place.
Yeah.
But if you have been jailed or confined to,
Mm.
like the so-called the terminal criminal going for the so-called gallows, they stay in their own isolation. Oh,
Mm.
that really will change their mind. They
Mm.
become more fearful. They become more uncertain how to face the death and things like that. So some people, even with this loneliness, with this so-called confinement, they may end up that way because of their internal self, which is vulnerable. The weakness is there.
Mm. Okay.
So
Yeah.
we don't know how people will respond.
Yeah, and recently also, yeah, this one is just like something that I just thought about. Recently I've been, you know, working on, like, remember the Myers-Briggs personality test that we discussed about
Yes.
a couple of weeks ago last year.
Yeah.
And yeah,
Yeah.
so in this situation, if somebody who's introverted and also somebody who's extroverted, how do
Mhm.
they respond to uh a crisis? Is there a different way on how they actually can,
Mm.
maybe, to share with, I think some of us here could be also introverted, some of us here could be extrovert, so how do you think we can overcome?
Okay.
Mm,
First and foremost, I think we need to know the difference between a private person and an introvert person. All
oh,
of
okay.
us are actually a private person. We still can actually go out and meet people and have a social circle, but we are not really as extrovert. That means we really socialize with anyone, with everyone.
Right.
We are very selective. So actually, most of us are private person. To be really introvert, that could be the extreme, whereby you don't like social, you don't like relationship. But not necessarily introvert will end up with psychosis, even though it is part and parcel of a contribution to a psychosis,
Mm,
introvert personality. So what happened is, if you are introvert, obviously you lost one element, that is the interpersonal social support. You might even be actually not having a relationship with your own family, with your own parent, with your own sibling. So you don't have that social support as compared to extrovert.
yeah.
And extrovert possibly has also been tested in many ways
Mm,
with regard to relationship, with regard to life and living. So they are more prepared to handle whatever the situation they are. And
mm,
they have ways to actually fall back for other support resources and whatnot.
mm,
So they have got outlets as compared to introvert maybe don't have outlets. So
yeah.
obviously these two group of people will respond very differently. A person can respond like an extrovert because a private person surely will have a few good friends, a few close friends that they
Mm,
identify with themselves, and they feel actually very comfortable that they can ask for help. But most
okay.
of us, because of ego self, we don't like to open to people our weakness. We
Yeah,
don't like to
we
be
don't like to be seen
seen
as weak.
as weak. We don't like to be shamed because when you feel you're weak, you're shameful of yourself. We don't like to be ridiculed by others. So this is another issue where your ego self sometimes play a very important part.
Mm,
So that's why you must also know when you need help, you must get help. You still
mm,
cannot handle yourself. That shows that things is not going to be better if you don't get the support.
all right. Yeah, but I think both has the struggle as well. Doesn't mean that if you're extroverted, you don't go through certain struggles, because pandemic um, has made us definitely physically, has created environment that we have to be physically distancing from our usual social circle. So a person who's more extroverted will probably feel there's a lack of
It,
social
in
life,
fact,
right?
in
Hmm.
fact, it's not only physical distancing; it's actually social isolation too.
Yeah.
We've been isolated among the common group people that we have. We are
Mm,
stuck even with the family. And I can tell you, possibly even at my generation, and possibly your generation,
mm,
and now the younger generation. all of us actually, even though we stay in a house, we may not have a good relationship with people around us.
Yeah.
We are so private person. I think that is okay because we have a tendency to be a lone and lonely person.
Yep.
But unfortunately, we don't like to be with the people around us in the house. If that person is actually somehow we are allergic to them, then
Mm.
you are stuck with them.
Yeah.
So that is not loneliness. That is actually giving you more, uneasiness
Yeah.
to
And
be
creating
with
probably
them
anger
for so
and a
long.
lot of all these emotions that come up.
Yes, frustration,
Mm.
anger, irritability, all will come out. Your emotion will come out.
Yeah, and that's why I think we've heard of like divorce cases or domestic violence happening. So yeah,
Yeah.
to due to those reasons, and also shutting down like
Mm.
everybody's living their own life kind of thing. Although they're living under, I mean, it's definitely it also happens commonly pre-pandemic, but even I
Yeah.
think during pandemic it's being magnified a little bit more because it's a bit more intense. So I think yeah, that's
It's
very
not only
important.
intense, but it's also prolonged.
Yeah,
Now it
prolonged.
has gone to 1 year. So
Yeah.
new crisis will crop up. Not
Mm,
only the pandemic crisis, but added crisis will crop up. So I guess if money is no more there, and then it's overcrowding, and you can't run away, you can't celebrate, you can't meet up with your family, other family members. I think those are the triggering factors, maybe contributing
mm.
factors.
Yeah, maybe perhaps we can have a session, next couple of weeks to talk about that. What are the other possible crises that can crop up, and how do we
Mm.
manage it? So I think that
Yeah,
will be very, because I think people don't talk about it. Mental health itself is a very broad topic. But
mm.
like they started off with like talking about loneliness. Like you said, overcrowding and uh, the financial issue will crop up. So what are the other areas that might have that kind of problems? I think I think we shouldn't. There's no longer escaping it, because I feel that given the vaccination, although it's already here, it's good that the frontliners are getting it. But it's also going to take time, and
Yeah.
the mutation of this virus, they will definitely continue. And yeah, it will take some time till everybody is probably have to like come out. Sometimes it's also fear, that paranoia of like
Yeah.
socializing, because after 1 year of not really um, leading a normal life, that also creates a lot of anxiety and fear, besides the other stuff, right? Yeah,
In
so I
fact,
think
one new phenomena that crops up is paranoia. You're
mm,
paranoid with people around you,
yeah, like
especially for
is people
the.
wearing masks, is the
Mm,
person next to me it's potentially a COVID-19 carrier,
no,
things like that.
if you see someone coughing next to you,
Yeah.
and if you
Everybody
go
will be
to
like,
clinic, you see someone having fever,
mm,
and you're also there, you start already, the thinking, overthinking all comes up.
right, right.
Uh, because that's why they say that, the worst place to go is to go to clinic or to go to hospital, because there
Yeah,
you don't know who is there, who will brought things
exactly.
up.
Yeah, yeah.
So that could be the issue here.
Yeah, that's we feel you. If let's say you're listening to this conversation, or somebody is going through this, definitely we hope this will help you to understand a little bit more, and stay tuned with all our future live streams. And also we do have all these recorded versions, because the prof has given his time and effort, not only doing his work lecturing, and doing his counseling, but being able to show up every week, almost every weekend without fail, to share some of the really good topics that can really help us. So it's just not about, maybe it started because like we needed an outlet to connect with people, right? But I think it has become like a bigger thing,
Yeah,
and it has create different, I would say, different kind of bonding,
yeah.
and sometimes we realize, oh, there's so many ways that you can actually uh, reach out to people besides a hug, because hugging or shaking hands is so common in our culture.
Mm.
And I think, I don't know when was the last time I had that physical touch with another
So
person.
1 year ago,
Yeah, 1 year ago, right?
1 year
And even one
ago,
year ago, I probably took it for granted. So,
yeah.
so that is the one thing that it's very nice to be able to have that kind of bonding, and yeah, having a same common interest or having something that we feel passionate about. That's why we keep showing up. And yeah, I want to thank Prof for your yeah, you prepare every week for all the sessions that we have done. You've always
Mm,
given your best, and yeah, we look forward to reach out to more people, and
mhm,
hopefully to yeah expand, and definitely do more in the future. And for 2021, we still have, I think it's still very important. Generally, I'm quite a positive person, although I've taken like a step back to reflect. But I think we still have to move on with 2021 with hope, with looking forward, just one step at a time. Yeah, not too anxious about what's going to happen, or no regrets of what's
mm.
happened in the past. We all learn a lesson. We all learn from our own experiences and other people's. And yeah, and we can definitely uh, co- hold hands, but not physically holding hands, like berganding bahu, or we have this kind of social network and support, to yeah, to move on, and do more things that we want to achieve. So I think that's why we are, the human race is born with, with thoughts, with the ability to make decisions, ability to interact, ability to think. I think we are put on this earth for a purpose, for a calling. So, so yeah. So we wish everybody a good weekend. All right.
I
So
think my
mm,
last word will be always live in the present,
yes,
so that every present, if it is a successful present,
yeah,
don't worry about your future. It will
yeah.
be a very good future. So
And
because every day, every steps matters.
yes, and Amani just gave a love. So yeah, she
Yeah,
gave a reaction. So
okay.
see, this is how we communicate, right?
All
So
right.
yeah, so you can put a thumbs up, you can put a love. I
Okay.
think that's really good. Yeah, yeah. Thank you, Kay, for joining us. Thank you, Aisha. Thank you, Jasram. Thank you, Dohani. I think Dr. Shakir is on Facebook watching us live. Probably
Okay.
I think certain people's connection is not too good this weekend.
Mhm.
And yeah, and hopefully everybody that's going back to, especially those studying, to offline classes, and like to parents busy buying their children's, preparing their uniforms and
Mhm.
things like that. So yeah, because we are going to start school. Stay safe. Remember the three C's, to avoid, confined spaces, crowded places, and close contact. Wash your hands. Jaga kita. Follow the SOP. Right. And we hope everybody well, and we'll see everybody next week.
Okay. Bye.
All right. Okay.
Thank
Bye
you for
bye.
listening. Bye bye. Have a good day. Have a good
Yep.
weekend.
Thank you, Coach. Thank you, Doctor.
Thank
Bye.
you.
Thank you.